not just epidemiological studies. Studies back in 1927, they took these medical students, put them on a high-fat diet, and within days, their insulin sensitivity dropped. They had twice the blood sugar spike to the same meal that people, kind of high carbohydrate, twice the blood sugar response, just 2 days eating these fatty foods. And we now know we do these lipid infusions. You can actually infuse fat, and within hours, we can see insulin resistance appear, blood sugar start to go up, your body has to churn out that extra insulin, and we have fancy drugs that can actually pull fat out of your system, and insulin resistance drops, and it doesn't have to be in the vein. The fat can go in your mouth too, and we have the same thing. The effect is almost instantaneous. Literally within hours, within days, we can get this insulin resistance, and that is what leads to these diseases. Now, diabetes is the 7th leading killer. It's an epidemic, becoming a pandemic around the world as developing countries are starting to take on the rich Western diet. It's just an absolute tragedy, and they're telling people to eat exactly what's causing the disease. In fact, that's why obesity is associated with diabetes, because you can get fat in your bloodstream, which gets in your muscles, 2 ways, either through your mouth or your fatty tissues. Actually, there's what's called a spillover effect. Actually, your adipocytes, the number of fat cells you have after about age 20 is about the same. The reason your butt, thighs, and stomach gets bigger is just your fat cells actually fill up with fat. They swell. You don't get more fat cells. They just get bigger. And when they stretch to a certain point, they start spilling fat over into your bloodstream, and that gets lodged in your muscles, and that can spill over, get lodged in your liver, and cause insulin resistance in your liver, make things worse, and then can actually lodge in the pancreas, in the insulin-producing cells of your pancreas, and then you can actually get that same lipotoxic, that fat toxicity in your pancreas that reduces, eventually reduces the amount of insulin you can produce, and then you're in florid type 2 diabetes, which is the #1 cause of blindness, #1 cause of non-traumatic amputations, #1 cause of kidney failure in this country. These are horrific complications, and what does modern medicine have to give them? Just trying to reduce the complication rate. Just not treating the underlying cause, and we can cure this disease even years into the process, which is really exciting. We used to think, we just kind of kill off these insulin-producing pancreatic cells, but it's actually, maybe we're just kind of suppressing them, and we can actually kind of wake them back up if we actually eat a cleaner diet, reduce that fat. Diabetes is a disease of fat toxicity in our organs, in our muscles, in our liver, in our pancreas.